treatment. Welcome to the debut of Inner Health, Outer Beauty, where we will shatter myths about health and discuss the latest and greatest non-surgical cosmetic procedures. I'm your host, Dr. Wanda Dyson, founder and director of Change for Life Wellness and Aesthetics on Capitol Hill in Washington, D.C., and an author of How to Be Healthy, It's Not What You Think. Today's guest is Lani Silveria, board-certified nurse practitioner, trainer, and expert injector extraordinaire. She is the creator of the Bella Vida Instant BBL, which I had the pleasure of learning from her. It is a non-surgical alternative to the Brazilian BBL, which is a surgery. Today, we will discuss the benefits and advantages of the Bella Vida Instant BBL. Welcome, Lani.
Thank you so much for having me. And I'm so excited that you asked me to be on your podcast. I'm so excited to speak with you. You look beautiful.
Thank you. You too. And of course, you're beautiful inside and out. Thank you for taking the time out of your busy schedule to join me. So, I want to know, why did you create the Bella Vida Instant BBL?
So first off, surgery is an amazing thing, but the way that people have been doing surgical BBLs has caused lots of deaths. As we could see from the news, we get letters from the FDA all the time telling patients, please take precautions, or us to tell our patients precautions. So I wanted a safer, easier way to get a nice plump booty, but also to be safe and something that's going to last longer. So this was created for those people who don't have the time, the money, or even the fat to transfer it into that area.
Right. Can you describe the procedure? How does it work?
Yes, so I use a product called Radius. It is from a company called MERS Aesthetics, and basically it's a biostimulator, and this is why I love it so much. It's creating your type 1 collagen, your type 3 collagen, and elastin. There is no other product on the market right now that is doing that, and the results are lasting anywhere between 2 to 5 years, especially if you do like an x-ray of the patient, because it's calcium based. So basically what I do with the procedure is by cannula, we make a little insertion point that usually closes within 24 hours, and we're laying out the product throughout all the areas that you want corrections for cellulite, stretch marks, lifting, just almost like to Photoshop your booty. So that's basically what we do with the procedure.
So you can do it for different areas, like if they want to add to the shelf or hip dips, or they just want more volume or more projection, correct?
Absolutely. So there's so many different ways to do this, but for the most part, most people come in, or women come in saying, you know, I want a little bit more of a shelf on top. And this is a great way to create that. So you could either isolate it to that area that they want, or just do an overall rejuvenation, as you've seen in the trainings. And everyone's happy, and I love it because everyone comes back for more. So that's the even better part.
I find they love it as well. Are there any side effects?
Side effects with any injectables, it's very common. So I love it when patients are like, I have an event tomorrow, so I can't be swollen, I can't be bruised, I can't be red. So please do your best. And we have a needle in our hands, and we're looking around like, if I'm going to touch you for any type of injectable, it is instant, but you also have those precautions. Again, you will have swelling, you might have bruising, you might have a little bit of redness. So you have to basically make sure that you don't have huge events, because it's just what happens. We have a lot of veins and arteries in our body, and something can potentially go wrong. Thankfully, with the Bella Vida Instant BBL, the way that it's prepared, the way that it's injected, I have maybe had 2 bruises in the past, let's say 300 clients. So it's a good odd.
So I would say that the side effects are way less than getting surgery, a surgical BBL. right?
Absolutely.
And
Yeah, with
most of the
surgery,
time,
go ahead.
I'm sorry, most of the time they can go right back to work, correct?
Right.
All
The
right,
next day, I have patients that are out in the boats out here in Miami the next day at jet skiing. So it's working for a lot of people.
great. So what type of aftercare is required? Do they need massages? Do they need garments? Do they need special things to sit in, special cushions, or anything like that?
Right. So best thing about the Bella Vida Instant BBL is that the only precaution that I give my patients is don't put too much pressure on it. Just like if you're getting injectables in the face, we tell you not to sleep on it because you might flatten out the product within the first 48 hours. So I usually tell people no pressure, no vigorous activity, whatever that may be, no submerging underwater, and no sauna. So make sure that the Band-Aid stays on for 24 hours, the insertion point closes, and you're good to go.
Can they sit down?
I advise people not to put too much pressure. So if you just got the procedure and you're driving home, I can't tell you not to drive home, but as soon as you get home, just lay on your belly, give it that 48 hours. You're making an investment in your body, so take care of it as such.
Do any of your patients need pain medication?
It depends. So if it's a patient that I have to do subcisions, meaning I'm breaking up the cellulite band so that it looks way smoother, most patients will need a little bit of acetaminophen. You could take Tylenol, extra strength. I say stay away from ibuprofen or blood thinners just so that you don't get latent bruising later.
So just for the lay people, the subcision is for people who have like dimply booties, you would say. It's really
Yes.
uneven. So we go in and actually break those areas up and smooth it out.
Yes. So it is a little bit more painful, but I've realized that most of my patients are willing to take a little bit more pain to get better results. So obviously nobody likes cellulite. So instead of using a different product that can bruise you even more to break up those cellulite bands, you could go in and subsize it, which again will make you feel sore for maybe an extra day. But once the product settles, it's so nice. So that's the most vigorous part of it, and not everybody needs it.
Correct. And that's what you call the project booty. And
The
those types
project
of
booty.
patients that have a lot of irregularities, it may take more sessions to get it really smooth, right? So you have to
Absolutely.
prepare patients that may need that it might not be a one and done. Correct?
Correct. I always set very realistic expectations because, when I made this procedure, it was again for someone who cannot get or gain fat or have fat for the fat transfer. So basically, if you do have it, or if it's post BBL, which a lot of my clients do come in for that, you have to realize you might need more sessions, you might need a little bit more subcision. So I do realistically give them a plan of care, just like any practitioner would.
So explain to the lay people exactly what subcision is.
Okay, so subcision is when you're going sub-Q, so subcutaneous right under the skin and breaking up the bands. You could do that for cellulite, you could do it for scar tissue, you could do it for any type of irregularity, even for stretch marks to kind of pop out that skin. So think of it as cellulite. Those bands are holding the skin down. So what I'm doing is going right under the skin and breaking it up, and then that skin kind of pops out to make it look, again, photoshopped, nice and regular.
And then after that, we lay down the radius, correct?
And then we lay down the product in exactly how I showed you in the training. And, you start getting that collagen buildup. So the bands won't attach to the skin again. And again, it just makes it look nice and smooth.
Beautiful, beautiful. So which patients are the best candidates for the procedure? Is it a certain size limit, or are there other patients that are best for it?
So the perfect patient is a patient who cannot get the surgical BBL. Again, no fat. So it's almost like a clean canvas. And usually these people don't have any stretch mark cellulite. So you're just creating volume, which is wonderful and nice and easy. Thankfully, most patients who come in now have had surgery, irregularities, so they need more than one treatment. But again, if your BMI is over the 18.5, you're most likely going to have to do more treatments. Like I've done 4 myself. I'm Brazilian. I have, you know, a little bit more curves. So 20 syringes for me is not sufficient enough. But if I have a tiny little girl who, you know, she has noodle arms, so skinny, it's going to look amazing. And her butt's going to look enormous with this because of her surface area.
Great, great, great. So a patient that's had a surgical Brazilian butt lift can come in and get more volume added with the Bella Vida Instant BBL if they want to, correct? Do you have many patients that do that?
Oh yeah. I mean, again, I live in the booty capital of the United States right now.
Miami.
Everyone in Miami. Everyone wants to be in bikinis. Everyone's on a boat. It's summer all year round. So post BBL, pre BBL, again, it's activating your own collagen. So this is not something that even if you do have surgery or you lose weight, that is going to go away. We lose 1% of collagen after the age of 25, and most of it is in our face. Usually you see more surface area, more fat in our thighs and our legs, and, you know, our little tire right around our belly. But you won't be losing that collagen as easy as you think. And that's why it's lasting the 2 to 5 years.
To schedule your Bella Vida Instant BBL with Dr. Dyson, call 202-575-4660 or visit cflwellness.com. I recently performed a Bella Vida Instant BBL on a patient that absolutely couldn't have surgery because she had a brain aneurysm. Do you have many patients like that? That there's no other option for them?
Correct. I've had some patients who it wasn't just the aesthetics of having a bigger butt. I did have this one girl who had a hormonal imbalance. I believe it's because she had PCOS. And they said that if she gets any surgery, it's going to mess with her hormones. So she was scared that this was going to do the same thing. But once I spoke with her doctor, honestly, he was like, if you're leaving it subdermal, you're not going below the muscle, you're not injecting it into an artery or vein, this should not cause any type of inflammatory response with anything else that's going on hormonally with you. So I have had some patients, I always take precautions because, you know, obviously it's our license. I always ask for prior authorization just in case they do have something, but haven't had any problems since, you know, since I had invented this. It's been since 2018. So it's working amazingly and it's safe. That's my favorite thing about this whole thing. You see results and it's safe and quick. We need that. We need safe. So yes. After they get it and they want to maintain their results or they want them to last longer, how often would they need maintenance? So again, it depends on the size of the person, but just like with any aesthetic beauty thing that we do, you're not going to do or use an under eye cream under your eye and expect one day to have beautiful tear troughs. Or if you want these huge Kylie Jenner lips, you're not going to just get one filler. Or Botox, you can't just get it once in your life and then never expect it to do it. So everything with beauty and anti-aging is a maintenance. It just depends. How good is your diet? How hydrated are you? Are you working out? So those are 3 huge factors. If you come and get this done and then expect your butt to be perfect for the next 5 years, that's very inaccurate. Again, a maintenance, I would say every 2 to 5 years, depending on how your body reacts to the product. But again, everything is a maintenance. Cellulite's going to come. I don't know if you're eating pizza and having soda or you're, you know, juicing. So it depends on the lifestyle of the person. So we're all unique individuals as to how long it will last. So what I tell them is they'll notice before me because I don't see them every day. They'll know. Exactly. I don't
Yeah.
have a crystal ball saying you need it tomorrow or in 2 years. Exactly.
Well, how does the Bella Vida Instant BBL compare with other non-surgical BBLs like Sculptra? And I heard one
So,
patient call me and said
yeah.
that they got a hyaluronic acid filler. Of course, that didn't last very long. But
Correct.
how would you compare to others?
So, number one, when people tell me that they've had a booty injections done with a hyaluronic acid, it makes me cringe. I want to cover my face because hyaluronic acids, especially in areas where you have movement or you're using a lot, will metabolize way quicker. Again, it's more for hydration and structure, but again, it goes away anywhere between 6 to 9 months, sometimes even 12 months if you're using a thicker hyaluronic acid. It's not good for the subdermal tissue in the tush because you're constantly sitting on it. So number one, whoever sells with the hyaluronic acids, it might look good for a couple days, but it's expensive and you're wasting your money. And then we also have Sculptra, which I absolutely adore Sculptra as well, but I was getting a lot of non-reactive patients. I was getting a lot of hyperpigmentation, and honestly, most of my clients they need instant gratification. They don't want to do Sculptra and wait 12 weeks to 6 months to see the results. And then nobody has time to do 5 massages 5 times a day for 5 days. No one does it. And the thing with Sculptra is it's like the seeds inside the Sculptra, we're planting it in your skin. So if you're not activating it with those exact instructions, you're not going to see the full results. And by the time it starts kicking in at 12 weeks, who has the time to keep track? So then now you're having to plan your outdoor activities for your body contouring for 12 weeks. My clients don't have the time for that. So again, Radiesse acts as a filler and a biostimulator. That's why you get the instant gratification. And then it's almost like I say it's the gift that keeps on giving. It's going to get better with time. Once it goes from collagen type 1 to 3, and then when your elastin kicks in, it's just lifting. So I see more patients choosing the Radiesse.
Now, I noticed that you said the Sculptra causes hyperpigmentation. For lay people, that means dark spots on the butt, and that you actually use Radiesse to correct that. So it makes more sense to use the Radiesse in the first place rather than to have that issue and have to come back and correct it. I personally have used Sculptra in the past, and thank God I haven't had that problem, but you're seeing a lot of booty. So you're having patients that come in, quite a few, it appears, that need to get the Radiesse to remove those dark spots from their butt, correct?
Correct. And it was something that I didn't even notice or scientifically didn't understand. But because the calcium is white, it's almost like a magic eraser for the hyperpigmentation, even the latent hyperpigmentation. So it doesn't happen to everybody. But I was getting a lot of what I say, project booties. Either something went wrong or another procedure messed you up or the BBL didn't go right. And honestly, the Radiesse has been correcting everything wonderfully.
Great. So let's talk about those back alley procedures that people are still going for, like the silicone. I don't know what else they're injecting, tire, flat, glue, super glue. I don't know. People are still doing that because they're so desperate to have a bigger booty. What do you think about that?
So again, I'm in the capital of the booties, and I know personally doctors from other countries and whatever's going on in the world, but they are getting so desperate for money, and the patients are so desperate for their aesthetic procedures that they're willing to put their life on the line. I know doctors out here in Miami that are injecting vitamins to increase your correct. There's no vitamins that's going to increase your surface area in your booty. I know someone who's doing medical grade silicone. I know someone who is doing synthol. Have you heard of that one?
No, I haven't.
That one's It's an intramuscular synthetic steroid that they're calling vitamins, and it's increasing the volume. It hypertrophies your muscle. Looks amazing. We don't know the effects of it later. And the injector is not a medical professional license in the United States. So we do have a lot of that. I just tell people, if you value your life, do the safe thing. Nothing that is safe, or it's going to be expensive no matter what. But would you rather pay, again, the 7,000 to 9,000 and be safe and, see results better, get better within time, or go to the butcher shop, which I call Calle Ocho over here? It's 8th Street, where all the doctors from other countries are injecting. I'm not taking away that they don't know the skill, but they're putting their patients' lives in danger. And I've seen people injured. I've seen people had to have surgery. I've seen people botched, injected into arteries, and even sued. So they just move from place to place here in Miami until they get caught again. So since they don't have their license, they're not very ethical. So I can't say anything. I just offer a safe way to get the results that you want.
So do any of those patients with back alley injections come to see you and try to get it corrected, or have complications that they want you to fix?
Absolutely. Problem is that those complications, you have to go to a plastic surgeon. Again, everything that I do is non-surgical, and I could give you advice, but for the most part, there is actually no surgery that they can go in there and take out the hypertrophy in your muscle, the expansion of your muscle. You have to wait and see what it's going to do. And again, we don't know what it could do in 2-3 years from now. Or if you had silicone injected into an artery, you're going to get necrotic tissue. It's going to be dying. So you need to go to a plastic surgeon and kind of get that subsidized out of your body. You got to scrape it out, and it's going to mess up your anatomy, honestly.
So it's cheaper in the short run, but more expensive in the long run, and lots of pain and a long road if they don't do something safe like the Bella Vida Instant BBL. And if they get surgery, what type of complications might they see?
So thankfully, they just changed the laws. I'm not sure if it's all over the United States, but because the surgical BBLs they were so wanted around here, right now they have to do it under ultrasound, and I believe they could only do 3 to 5 surgeries a day, which from what I remember in 2020, I know doctors who were doing anywhere between 10 and 12, but I don't think there were any guidelines. So now that they're doing it under ultrasound because there was a lot of deaths, and especially out here in Miami, the death count was very high. Or if they weren't doing it here, they would go to Dominican Republic. So they have changed that. Again, it's safer, 3 to 5 surgeries and ultrasound guidance to make sure that you're not injecting the fat into any arteries or veins to potentially have a DVT in one of your patients.
Is there anything else you want to say about your experience of doing the Bella Vida Instant BBL?
I am so blessed and thankful that this has been one of the main procedures that people are wanting. It's safe, it's fun, everybody's happy after the treatment. Even if you're not happy right then, right after, you wait that 4 weeks and you're getting that collagen. So I'm just very thankful that I'm able to share with everyone a safer way to create the body that we want. And, we're all insecure about something, but there's always a fix, but do it the safe way.
Thank you. Thank you very much. Thank you for taking the time out of your busy schedule. I'll be calling you. Have a great day.
All right. Bye, you guys. Nice speaking with you.
Bye-bye.
To schedule your Bella Vida Instant BBL with Dr. Dyson, call 202-575-4660 or visit cflwellness.com.